hectic. Our next challenge is going to be the Sanofi Diabetes Challenge. This is a challenge that we're looking for tech-based solutions to help diabetic patients live happier and healthier lives, which I can't think of a better, more altruistic way to do that. So without further ado, I'm going to welcome down my 3 startups. I've got Ilara Health, I've got Akili Labs, and I've got Baobab Circle. Come on down, please. Thank you very much. Jerry, I'm going to welcome you as well. Thank you very much. Ilara, you're going right there with the clicker. Thank you. There you go, buddy. Baobab, yeah. Perfect. So you know the drill. 3 minutes on the clock. Press the green button. 3 minutes on the clock. 3 minutes to pitch. Jury's going to be waiting. You need a microphone? I'm so sorry. Can we have a microphone for our corporate sponsor? There you go.
Thank you. Good afternoon, everybody. Hopefully we can get the energies going. So I'm from Sanofi. Sanofi is a multinational healthcare company serving the interest of patients globally. The employees at Sanofi work very hard to take scientific discoveries and convert them into medicines to improve the healthcare of patients around the world. However, at Sanofi we have realized that it's not only the medicines that will improve human health care. Okay, we need the likes of tech startups and technology to make these scientific discoveries more available and accessible to more people in the world. If you think about Sanofi's business, it's very diverse. We have products and medicines in many therapeutic areas, including prevention, which is our vaccines, and amongst other diabetes, of which the challenge is based on. Diabetes in South Africa is scary. We heard about women not being represented in equity fund, private equity. But do you know that diabetes is the leading cause of death amongst females in South Africa? Our mothers, our sisters, our girlfriends, everybody are dying because of diabetes. More needs to be done to change this epidemic. If we do not find solutions now, the human population will become obsolete and redundant because we need to do more. Diabetes and the management of diabetes is very fragmented. Okay? Your medicines can take you so far. However, we need an integrated approach. And the only way that we can get this integrated approach going is by relying on technology and digital solutions. So we are looking for tech-based solutions that can help our women, and not only the women, but all people around the world to live healthy lifestyles, because that is the mainstay of diabetes management. So I want to wish the 3 startups all the best, and I know you guys have done a lot to get to this point, and I want to thank you for your contribution to making a difference in the cause of diabetes.
Is there any other introduction? All right, Ilara, the floor is yours. 3 minutes.
This is Dr. Boniface. He runs a small clinic in Karangware, in the outskirts of Nairobi. He's trained as a clinical doctor. He dispenses medicine one by one, and he does consultations to patients in his low-income community. When I met him the first time, I asked him, what would you need to better do your job? And he immediately answered, I would love to have a small lab. This was an aha moment for me. I visited 200 clinics and pharmacies outside Nairobi, and the quality is shockingly poor. I'm Emilian, and I'm the CEO and co-founder of Ilara Health. And we make diagnostics more affordable, accessible, and accurate in Africa. 70% of clinical decisions require some sort of diagnostics. But there are 500 million people in Africa who today cannot access or afford even a simple blood test. But thanks to the developments in artificial intelligence and robotics, there are companies making diagnostic devices which are much smaller, cheaper, affordable, and which can work directly into the doctor's office, providing results in minutes. At Ilara Health, we do 4 things. We partner with those companies, and we integrate their devices into our technology platform. We distribute this bundle door to door into clinics and pharmacies situated in peri-urban and rural areas where 70% of the people live. And we provide financing, which is very important. We charge an affordable price per test or subscription, and we keep scouting for the latest developments in diagnostics to place them into the doctor office. You may know that some of the major reasons patients go to see a primary healthcare doctor, there are just few of them. But 4 major reasons are diabetes, cardiac diseases, pregnancy, and infectious diseases for upper and lower respiratory infections. Those cover about 80% of the demand. The market is massive. There are about 200,000 clinics out there and about 150,000 pharmacies in the major markets we target. Since we raised our seed round, we've been in 20 clinics. We can get to about 70 clinics and pharmacies by the end of the year. Dr. Boniface, whom you see here, has offered, with our bundle, HbA1c tests for half of the price any lab in Nairobi would charge. And we have what it takes to build an amazing business. We have entrepreneurs, medical, and technology. I've been Africa-focused venture builder, entrepreneur, investor for the past 10 years. Our vision as a team is to bring affordable diagnostics to millions of Africans while digitizing the clinics and while bringing the latest technologies, which counts. If we succeed, if we're successful, we can change health outcomes on a continent with massive challenges, but also massive opportunities. If you'd like to be part of what we're building, please come and find me. Thank you.
Sweet. Well done. Thank you very much. Judges,
Thank you.
I'm sure you have some questions.
The machines that you have, you say they compact and can be carried around. How big are they? Are they enabled for mobile devices?
Yeah. So what we bring is what we call a smartphone medicine. So everything which can be plugged into a smartphone can go from a size like this for HbA1c or glucose and lipid to a mobile ultrasound, which is the size of a bigger pen.
So does the patient still have to prick themselves to do the HbA1c?
The patient, those are point of, so we place them at a point of care. Okay. So the patients will come at a point of care.
Where is collected the data? Where is the stockage?
Great question. So two ways we get data. We get data from the devices because we plug those devices with APIs into a tech platform, so we get the data from the test. But very interesting is that clinics need help to get more patients. So clinics give us their patient data for us to SMS those patients. We have a chatbot. We SMS those patients to bring them to the clinic. For diabetes, for example, we run a campaign now where we bring people to get checks for diabetes. And we get the data from the clinic. So we actually end up with about 150,000 patient data currently. We don't take the names, but we take the rest of the data.
How is the competition landscape?
So it's a very, very great question. No one really, our main competitor is the lab, which is almost non-existent in those areas. And the medical equipment distributors, which do not target those areas because their low-hanging fruit are the cities, not the outskirts. So no one really builds this, I would say, this kind of Apple store where you bring various devices and you plug them and you place them in those areas. At least not in Kenya.
Hi, thanks for your presentation. Do you have any regulatory issues or challenges?
Sure. So Kenya just approved this morning actually a data protection law. So we need to be very careful in terms of what data can we capture, what data cannot capture. Obviously each device we bring, because we bring them from the US, China, India, we need to register them with a pharmacy board, with the FDA of Kenya, now in Kenya, and then the other markets will do the same. That's a process which is normal.
All right, well done. Thank you very much. No added pressure, but our Your Equity stream is now live. You're being broadcast across the world. Ilya, the floor is yours.
Okay, hello everybody. My name is Lucas and I'm from Achille Labs. And I'll be taking you through how we would like to tackle diabetes. So a core part of our company is looking at conventional diagnostics, and a few quite obvious issues that we've found is that conventional diagnostics are expensive, centralized, and slow. And so everything we do, be it hardware or software, we design to be inexpensive, we design it to be ultra portable, and we designed it to have quick turnaround times for diagnostics. Now, diabetes is a very global issue. We have 30 million folks in the US that have diabetes. 10% of all individuals living in Asia and in the EU have diabetes. And in Africa, 16 million people have been diagnosed with diabetes. What's scary is that 70% of people living here with diabetes don't know that they have it, and if left unchecked, we could see a 160% increase in diabetic prevalence in the next 20 years. So our solution consists of a small hardware molecular diagnostic device, an IoT healthcare kit with blood glucose testing capabilities, and a subjective software assessment tool. So how does this work? We have a patient come in, they fill out a subjective questionnaire, and based on their lifestyle habits and answers, we place them into a low, a medium, or a high risk category. After this, we proceed to draw some blood. From this blood, we perform a diagnostic test for blood glucose. Then we prep the rest of the sample and extract genetic material. From this genetic material, we look at some of the 90 regions that are associated with an increase in risk from a genetic level for diabetes, diabetic prevalence. And after we've analyzed that sample, everything feeds into our small mobile EHR system. From here, it gives us two things. It gives us an actual diagnosis, and it gives us a very accurate risk assessment based on lifestyle and based on genetics. This way, we can consult with the patient and say, these are the changes you need to make to improve your healthcare. And the question is, what qualifies us to do this? In the last few months, we've run a similar program with the Gates Foundation and the IPRD group to do a similar thing for HIV risk assessment, placing individuals into a low, medium, and high risk category, and then performing a diagnostic test to improve our predictive modeling. In the next year, we'd like to, in the first few months, roll out our new subjective assessment and test the algorithm to start learning what's out there for diabetes. After that, we have a possible partnership with Netcare that we'd like to investigate and test in their facilities. And after that, roll out nationally and run a national pilot to see how effective our system can actually be. On our team, we have 2 biotechnologists and a medical doctor. And my time is up. So thank you very much.
All right, thank you very much. Question and answer time.
I requested the stability of your machine in different countries. You know, you have varying temperatures across Africa. So how stable is this machine across those different geographies?
So our system uses DNA amplification methods at room temperature, and our most unstable enzyme can go up to 76 degrees Celsius. So unless the sun is extremely hot or you're putting it in an oven, it's going to be A-okay.
And then my second question is, how expensive is this relative to other diagnostics that are there to make the diagnosis for diabetes?
So what's wonderful about running the subjective assessment first is that a questionnaire costs nothing, essentially. And then our diagnostic device, we are aiming at selling for about $500. And our test cartridge cost anywhere from $3 to $5 for a test cartridge that can take 6 samples on each cartridge. And we've seen from competitor pricing that we are either on par or 20 to 30% below their pricing.
For the African market or only country?
So for the African market in general, yes.
And what about energy? Is the tools and the suitcase is going to be used in a health center?
So yes, it can be used in a health center. You know, it can be used in your GP's office, can be used at a hospital, or can be used in the middle of nowhere. Our power consumption is extremely low, and right now preliminary tests have shown we have about a 2-week battery life with up to 100 tests done per day. So very, very low power consumption.
Thank you.
Ask the last question. So with any predictive diagnostics, there should be a proposed solution that goes with it. Does your machinery have that capability?
Not as of yet. So right now we're placing them in the risk category, and from there the plan is to provide a treatment or a lifestyle change regimen to say that we know you are doing, having a few drinks per day or per week, this is what you should cut down on. And it obviously relates directly back to the questions we asked them in the first place.
Okay. All right. All right, okay. Thank you very much. Next up, we've got Baobab Circle. 3 minutes on the clock.
There we go. So hi guys, my name is George Franklin. I'm co-founder at Baobab Circle, a health tech company focused on chronic disease management across Africa and recently into the Middle East as well. So we heard diabetes is a massive problem globally, and especially in Africa, due a lot to the case that there are incredibly low doctor-patient ratio. As a result, the average consultation time is under a minute, and people suffering from chronic conditions simply don't get the advice that they need to successfully manage their condition on their own. As a result, the main outcomes of diabetes on the continent right now are blindness, amputation, and death. And that's quite frankly ridiculous because it's a disease that can be, a condition that can be quite easily managed with the right level of education and advice. And so we took that and we looked at the prolific growth of mobile phones across the continent over the last couple of years, and we thought, well, what if we could provide micro-consultations and advice directly into the palms of an individual and drive behavioral change and health outcomes through that? So we created AfricArena, which means Health Now in Swahili. Kenya was our first market. And essentially what we've done here is create a chat bot where an individual receives a text message or a notification if you have a smartphone, inviting them into a conversation on a daily basis. And essentially, the more conversations an individual has, the more personalized, relevant, and importantly, localized that information becomes to that person. So we're actually able to prove that this has significant health improvements through our health tracker. So we also encourage people to upload their blood pressure, blood glucose levels, and their mood in between clinical visits. And this is all fed back into the chatbot. But the second thing we're doing at the moment as well is we're able to track drug usage and kind of measure adherence and importantly see the physiological effects of those drugs in the individual during their course of treatment. So our team is made up of individuals largely from a medical, telco, and insurance background, which is important because those are two main routes to market. And with that, I'll give it back to questions.
All right, clear and concise. Judges, the floor is yours.
So you heard Busi telling us this morning that the biggest gap that we have in South Africa and Africa is the infrastructure. And we need to strengthen the infrastructure. And we know that most patients in South Africa don't have access to Wi-Fi or let alone smartphones. How do you foresee overcoming that with your solution?
So we have the app, but a major part of it is the SMS, the USSD service that we have. So essentially, it's a chatbot that runs over SMS, and people could interact. They receive a text message inviting them to a conversation, they can interact back. And so we scale that through partnering with telcos, so MTN in Uganda, Telkom in Kenya, and so Vodafone in Egypt. I mean, that's essentially, how we're accessing the patients there.
Do you own the technology you own?
Sorry?
Do you own the technology
we own it,
you
yeah.
own?
So all the content is created by us and by our affiliated doctors. It's then localized, and actually, I mean, quite importantly, to kind of convey the messages across, I started writing content back in the early days, and I quickly learned quite how boring I am. So we hired a group of journalists in Kenya, our first market, to try and really simplify it and deliver health in a quite considerate way. So yeah. But in terms of the actual technology itself, the chatbot is entirely built by us. The machine learning is all built by us, and you know, we're compliant with GDPR as a result of being a UK company. Yeah.
Is the app zero rated?
Sorry?
Is the app zero rated? So
no. So we charge a subscription service, a subscription model for the app, and the app has been most popular with our insurance partners, who essentially pay for the app on behalf of their clients, and then the individuals receive it for free. With the USSD, we use airtime billing through the telcos.
Sorry, I meant zero rated in terms of data usage.
Oh, it is, yes.
So with the limitations of USSD, where you are limited by the number of texts that you can write? How do you individualize the messages that you send to the patients?
So right now it's a decision tree format, and so individuals respond to questions that we ask them, and depending on the way they go down, they receive a kind of, as we receive more information, the messages and the advice becomes more personalized to that person. We also obviously encourage people to measure themselves. We have a devices side of the business, which is really increased engagement for that. But individuals upload their blood pressure and blood glucose, which feeds back into it, kind of creating that personalization. And as I mentioned, the localization is something that's very, very important because different cultural regions, I mean, even in Kenya, different areas of Kenya have different nutritional preferences, different treatment availabilities, and so we take all that into consideration as well.
All right, well done, guys. Thank you very much. Come on down.